So it's important to practice safe sex, obviously before your age, to prevent HIV, but even when you have HIV, it's important. And it's important for a number of reasons. One is to protect the people you're having sex with, because HIV is transmitted through blood and sex. So even if you're not on any antiretroviral medicines, your viral load is likely to be detectable, and that increases the risk for HIV transmission through blood, needles, for example, or sex. But even if you are on medications, and let's say they're working really well and your viral load is undetectable, there's still, although smaller, but there still is a chance of transmission. So again, you'd want to be practicing safe sex, using condoms, limiting the number of partners that you have, so to prevent the transmission to the people that you're having sex with. So that goes for the other individual. But for yourself, there's a good reason to use condoms, and that is because you may be having sex with somebody who also has HIV or who has another sexually transmitted disease, and so you want to make sure that you don't catch the other sexually transmitted disease. But also there are different strains of HIV, some more aggressive than others, and I usually tell my patients that you don't want to be catching somebody else's aggressive HIV, especially when you're doing well. So lots of good reasons to continue to practice safe sex even after you're HIV positive.
It's really important that people keep using condoms even once they have HIV. For one thing, you're at a higher risk of acquiring sexually transmitted diseases, so you want to keep yourself protected and safe from other diseases. And for another thing, you don't want to transmit HIV to somebody else who may not be infected yet, so that's another reason that it's important to use them. In the case of being with somebody who's already HIV positive, it's still important to use condoms because people can have different strains of the virus and be exposed to resistance to different medicines, and so you don't know what that other person's HIV looks like, so it's just important for your own health that you continue to use condoms.
So that's another way that HIV gets transmitted. It's, I said, blood and sex, but also in utero during the pregnancy. So that's also another reason why it's important to get tested early on. So now we routinely screen women who are pregnant for HIV. If we find that they're HIV positive, we start them on antiretroviral therapy. And studies have shown, one of the most landmark studies actually in HIV care, shown that if you treat pregnant women with HIV medicines, the rate of transmission to the baby is reduced significantly. Not to zero, but significantly. So it's important to, if you are HIV positive and you get pregnant, to make sure you come in, start your prenatal care, and make sure you get started on or maintained on HIV medicines. And if you're HIV positive and you get pregnant and you're not on medicines, to come in. And again, the earlier you start your prenatal care in general, even without HIV, the better the outcome is. But even more important when you have HIV, so that you get started on medicines as soon as it's recommended. If you have regular sex without a condom, then yes, the female partner could contract HIV from that sexual contact. In fact, women are more likely to contract HIV through heterosexual sex, vaginal sex, than men. So, and the woman can get pregnant. If you have a discordant couple and they want to have a child, what can be done to be able to protect the woman and yet still have a child, and obviously protect the child? So there are different ways that this can be approached. For example, the sperm could be washed, and the fertilization can happen in vitro, for example, and then afterwards be implanted in the woman. So if a couple is interested in that, again, another good reason to come into care so that they can get referred to the appropriate physicians or providers to have that kind of thing done. It's very beneficial to come in and become engaged in care. Some patients, as you said, know that they're HIV positive and have decided that they're not ready to handle being cared for. A lot of it is denial or fear of coming in. Some patients may think that they might be infected and don't want to get tested. But the bottom line is that better to get tested and get engaged in care sooner rather than later, because what happens with with HIV infection is that over time, as I mentioned, the immune system is what gets infected, and over time the immune system deteriorates because of the infection. And it gets harder to treat when the CD4 count is below 200, especially below 100. It's not that the medicines still work, but the likelihood of the CD4 count coming back into the normal range is lower if you start out at a lower end. So if you start at a CD4 count of 50, then we're hoping that maybe it'll become over 200. But if you start at a CD4 count of 400, let's say, and start taking medicines, then there's a really good likelihood that your CD4 count will probably end up in the normal range. And why is the CD4 count important? Well, that's, again, the marker of the immune system. So if the immune system's not working very well, that's when people get sick from HIV.